We'd be sitting in our room and Danielle would be curled up in bed, weak and tired, and we would just anxiously wait for the blood to come because we knew that it was going to give her energy. If it wasn't for the blood transfusions, Danielle may not be here today. Kept her alive. We're just so grateful for the blood donors. I would like to tell them thank you for saving Danielle. I don't know if she'd be here today without the blood.
There's an ongoing need for blood donors because there's no other substitute for blood, and because blood transfusions are critical for cancer patients, patients having surgery, or patients recovering from traumatic accidents.
Blood transfusions were extremely important to Danielle and her treatment. Every time a cancer patient receives chemotherapy, their blood count numbers drop. And that happens because the chemotherapy is intentionally killing all the bad cells as well as the good cells. The transfusions, though, are needed to keep them on track with their chemotherapy, because if their numbers don't recover, then their chemotherapy is delayed.
Blood consists of 3 main components, and each component plays an important role in our health. Red blood cells give our blood its red color and deliver oxygen throughout the body. Plasma is the fluid part of our blood. Plasma also contains proteins that make our blood clot. Platelets work with the clotting factors in the plasma to prevent bleeding. They're also needed for the normal functioning of blood vessels. During a blood donation, platelets can be separated from the plasma in a process called apheresis, or automated collection. Blood donors can choose to give whole blood in which all 3 components are collected at once and stored together. Or you can choose to be an automated collection donor and give only the components that have the greatest medical need. Donating is safe, simple, and easy. As you walk into our newly remodeled donor center, our receptionist will greet you. You'll be asked to fill out a short questionnaire about your current health. Then you'll be escorted into a private interview room where a nurse will take your temperature and blood pressure and measure your hemoglobin level. That's all it takes. And now you're ready to begin the donation. If you're giving whole blood, the entire process takes only about 10 minutes. And after you're finished, you're invited to have a cookie and something to drink. An automated collection donation is only slightly different from giving whole blood. In an automated collection, your whole blood is drawn and separated into components. You donate only the most critically needed components, such as platelets or plasma. The rest of the blood components are returned to you. An apheresis donor gives 5 to 6 times as many platelets as a whole blood donor. And during the process, you can watch TV or a movie, or catch up on some reading. Automated donation takes about 60 to 90 minutes to complete.
The platelets have a very short shelf life, unlike the red cells, because platelets have to be stored at room temperature. We need donors coming in every day. So it's very useful to the patient who critically needs certain things to do an automated collection. At the same time, whole blood collection is also very important because not every individual or every donor would be eligible for automated collections.
I was a sophomore in high school, and in our biology class, the teacher took time to talk about the blood donor program. A bunch of us basketball players in the back of the room heard 3 words: avoid excessive exercise. Our coach was really tough, so we figured we could get out of practice by donating. We showed up and told him that this was because of our civic duty, we couldn't practice. And I think he ran us harder than he ever ran us before. And that started my donating 30 years ago.
Blood donation is extremely safe. Sterile needles and blood bags are used only once, and great care is taken for arm preparation, using aseptic techniques by our highly trained staff.
It makes me feel good to know that I'm donating blood that could potentially help somebody to save their life. It's a really good feeling to know that, again, if my family or my friends or my neighbor needed that donation, that hopefully somebody would be out there doing the same thing to help us.
I became a blood donor to help other people. There is a big demand for blood donors, and a lot of people just don't do it. And I figure it's such an easy thing to do, and it takes little time. And it's a wonderful gift, and it's a gift of love and honor to our patients.
We make each other strong, each other strong.
I think her hopes and dreams are to be able just to live a full life. This experience is going to help her find what she wants to do with her life. I think she's going to be wanting to give back and help support and be there for people. That's what I see.
The future for Danielle, they could go in a lot of different directions. She is so funny. She really could be a comedian. She would like to be a hairdresser, a makeup artist. I know whatever she does, she will do the best that she can, and she'll just enjoy it. She is really just here to enjoy life and have fun.